A 67-year-old patient walked into my office last month, shifting uncomfortably in her chair. She'd been dealing with chronic pelvic pain for over a year, and 3 different doctors had told her it was just part of aging. But when I examined her medical history and asked the right questions, I discovered something that shocked us both. She had no idea her daily self-care habits were the cause of her pain. I'm Dr. David Wong, and in my 20 years as a gynecologist specializing in mature women's health here at Elderly Health Central, I've seen this same pattern hundreds of times. What I discovered with this patient, and what I'm about to share with you today, changed how I practice medicine. She was making the same 7 critical mistakes I see in over 80% of my patients over 60. These aren't just uncomfortable topics we avoid discussing. These are medical realities that could be quietly damaging your body right now, creating pain, infections, and complications that most women never connect to their intimate habits. The truth is, after 60, your body changes in ways that make certain practices not just ineffective, but potentially harmful. Yet no one talks about this. No one pulls you aside to explain what needs to change and why. Today, I'm exposing the 7 most dangerous self-pleasure mistakes that older women make unknowingly. These are the secrets I wish I could tell every woman over 60, based on real cases from my practice and decades of research in geriatric gynecology. By the end of this video, you'll know exactly what to avoid, what to do instead, and how to protect your health and comfort for years to come. But here's what's urgent: mistake number 7 is so common yet so harmful, it could explain symptoms you've been ignoring or attributing to normal aging for years. Stay with me because this final mistake might be the key to solving problems you didn't even realize were connected. Let's start with the first mistake that's causing silent damage in millions of older women. Mistake number 1, the rush job error. I'll never forget Karen, a vibrant 63-year-old retired teacher who came to me with recurring UTIs. She'd had 6 infections in 8 months, and her previous doctor just kept prescribing antibiotics without investigating the cause. When I asked about her intimate habits, she looked embarrassed and said, "Doctor, I just try to get it over with quickly. I don't want to make a big production out of it." That phrase, "get it over with quickly," was the key to solving her problem. Here's what most women over 60 don't realize: rushing through self-care without proper preparation is one of the most dangerous mistakes you can make. After menopause, your body needs significantly more time to produce natural lubrication. Your tissues become thinner, more delicate, and less elastic. When you rush, you're essentially creating microtears in tissue that takes much longer to heal than it did in your younger years. These microscopic injuries become entry points for bacteria, leading to infections, chronic irritation, and progressive tissue damage. The medical term is insufficient arousal preparation syndrome, and it's completely preventable. Karen's solution was simple but transformative. I introduced her to what I call the 3-minute rule, always allowing at least 3 minutes of gentle preparation, using appropriate lubrication from the start, not as an afterthought. Within 2 months, her infections stopped completely. She told me, "Dr. Wong, I wish someone had explained this 20 years ago." But rushing isn't the only dangerous mistake. The second one is actually causing permanent nerve damage in ways most women never suspect. Mistake number 2. Using the wrong pressure points. Linda was 69 when she came to me, frustrated and scared. "I can't feel anything anymore," she said. "It's like my body has gone completely numb." She assumed it was inevitable aging, but her medical tests showed something different. Her nerve endings weren't damaged by time, they were damaged by technique. For over a decade, Linda had been applying direct, intense pressure to areas that, after menopause, become incredibly sensitive to damage. She didn't know that the clitoral complex changes dramatically after 60. The protective tissue thins, blood flow decreases, and nerve endings that once thrived on direct stimulation can actually be damaged by the same techniques that worked for decades. This is crucial. What felt good at 40 or 50 can cause permanent nerve damage at 70. The clitoris has over 8,000 nerve endings, more than any other part of the human body. But after menopause, these nerves need indirect, gentle stimulation to stay healthy. Direct pressure can cause what we call peripheral neuropathy, essentially numbing the very nerves you're trying to stimulate. I taught Linda the gentle mapping technique, using light, circular motions around the area rather than direct pressure, focusing on the entire pelvic region rather than one specific point. I also recommended she use her entire palm, not just fingertips, to distribute sensation more naturally. The improvement wasn't immediate, but after 6 weeks, Linda called me in tears of joy. "The feeling is coming back," she said. "I thought I'd lost it forever. Your nerve endings are precious and irreplaceable. Protecting them requires understanding how they've changed. But even if you get the pressure right, mistake number 3 could be setting you up for serious infections." Mistake number 3, ignoring the hygiene timeline. Rosa, 71, came to me with what she called constant irritation down there. She was meticulous about hygiene, showering daily, using gentle soaps, changing clothes regularly. She couldn't understand why she kept getting infections. The problem wasn't her general hygiene. It was her timing. Here's what changes after 60 that most women don't know. Your vaginal pH becomes more alkaline, your natural protective bacteria decrease, and your tissue takes longer to return to its normal state after any kind of stimulation. Rosa was making a critical timing error. She was cleaning immediately before self-care, which stripped away her natural protective oils, and then not cleaning properly afterward, when harmful bacteria had the best chance to multiply. I introduced her to what I call the golden hour hygiene protocol. Here's how it works. Clean your hands and external area gently 30 minutes before, not immediately before. This gives your natural protective barriers time to resettle. Use lukewarm water only, no soaps or cleansers that can disrupt your pH balance. Then, within 1 hour after, do a gentle cleanse with plain water, pat dry completely, and wear breathable cotton underwear. Never use douches, scented wipes, or harsh soaps in this time frame. The difference for Rosa was dramatic. Her infections stopped within a month, and she told me she finally felt comfortable in her own body again. But getting the hygiene timing right won't help if you're making mistake number 4, a frequency error that's creating a dangerous cycle of tissue damage. Mistake number 4, the frequency trap. Helen, 65, came to me with chronic irritation that wouldn't heal. When I asked about frequency, she revealed something I hear too often. "Well, doctor, I figure if a little is good, more must be better. Plus, I read that I should use it or lose it, so I've been doing it daily." Helen had fallen into what I call the frequency trap, misunderstanding the balance between use it or lose it and overuse and abuse it. Here's the medical reality: after 60, your tissue recovery time increases significantly. What used to heal overnight now takes 48 to 72 hours. If you're engaging in self-care daily, you're not giving your tissues time to repair and strengthen between sessions. On the other hand, going weeks or months without any stimulation leads to vaginal atrophy, where tissues thin, blood flow decreases, and sensitivity diminishes permanently. The sweet spot is what I call optimal frequency for tissue health. For most women over 60, this means 2 to 3 times per week maximum, with at least 48 hours between sessions. This gives your body time to heal while maintaining blood flow and nerve responsiveness. I also taught Helen to pay attention to her body's signals. If there's any tenderness, irritation, or discomfort, that's your tissue saying it needs more recovery time. Within 6 weeks of adjusting her frequency, Helen's chronic irritation resolved completely. She told me, "I had no idea I was overdoing it. I thought I was being healthy." But even perfect frequency won't protect you if you're making mistake number 5, position problems that are straining your aging body in dangerous ways. Mistake number 5, position problems that strain aging joints. Carol, 68, came to me complaining of lower back pain and hip discomfort that seemed to worsen after intimate moments. She'd been to physical therapy, tried different mattresses, even changed her exercise routine. Nothing helped. When I asked detailed questions about positions during self-care, the mystery was solved. Carol had arthritis in her hips and lower back, conditions that affect over 70% of women her age. But she was still using the same positions she'd used for decades, positions that now put dangerous strain on compromised joints. Here's what happens. Arthritis limits your range of motion and makes certain positions painful or even harmful. When you force your body into positions it can no longer handle comfortably, you create a cycle of inflammation that affects not just your joints, but your entire pelvic region. The medical term is positional pelvic dysfunction, and it's entirely preventable with proper adaptations. I introduced Carol to joint-friendly alternatives. Instead of lying flat, we found that a semi-reclined position with pillow support relieved pressure on her lower back. Instead of positions requiring hip flexibility, we identified alternatives that worked with her current range of motion. I also recommended she warm up with gentle stretching beforehand, just 5 minutes of pelvic tilts and gentle hip circles to prepare her joints. The transformation was remarkable. Not only did her back and hip pain improve, but she reported feeling more comfortable and confident overall. Your body deserves positions that support and protect it, not strain it. But even the perfect position won't help if you're making mistake number 6, tool trouble that's creating serious safety hazards. Mistake number 6, tool trouble that's putting your health at risk. Diane, 72, came to me with recurring bacterial infections and tissue irritation that had persisted for months. She was frustrated and embarrassed, convinced something was seriously wrong with her body. During our consultation, she hesitantly mentioned that she used some aids, but insisted they were clean and safe. When I asked more specific questions, the problem became clear. Diane was using tools made from materials that aren't body safe, cleaning them with household cleaners that left harmful residues, and storing them in conditions that promoted bacterial growth. Here's what most older women don't know. After 60, your body becomes much more sensitive to materials, chemicals, and bacteria. Products that might have been fine in your younger years can now cause serious reactions. The 3 biggest tool troubles I see are, first, material safety. Many products contain phthalates, latex, or porous materials that harbor bacteria. After 60, you need medical-grade silicone only. Nothing else is safe for your more sensitive tissues. Second, cleaning confusion. Diane was using antibacterial soap, which sounds good but actually leaves residues that disrupt your natural pH balance. The only safe cleaning method is warm water and gentle, fragrance-free soap, followed by complete air drying. Third, storage problems. Keeping tools in plastic bags or humid environments creates bacterial breeding grounds. They need to be stored in clean, dry, breathable containers. I helped Diane replace her unsafe products with medical-grade alternatives and taught her proper care protocols. Her infections cleared up within 3 weeks, and she's been problem-free for over a year now. Your safety is paramount, and the right tools, properly maintained, can actually support your health rather than compromise it. But even if you avoid all these mistakes, the 7th one might be the most dangerous of all, because it prevents you from getting the medical care you need. Mistake number 7, the silent suffering syndrome. Betty, 76, came to me as a last resort. She'd been dealing with pain, discomfort, and worrying symptoms for over 2 years but had never mentioned them to any healthcare provider. I was too embarrassed, she told me. I thought at my age, I shouldn't be doing those things anymore. I was afraid you'd think I was inappropriate. Betty's case broke my heart because her suffering was completely unnecessary. Her symptoms were easily treatable, but by staying silent, she'd allowed minor issues to become major problems. This is the most dangerous mistake of all, keeping intimate health problems secret from your healthcare providers due to shame, embarrassment, or misconceptions about age-appropriate sexuality. Here's the medical reality: sexual health is health, period. At any age. Problems in this area can indicate serious underlying conditions, hormonal imbalances, circulation issues, neurological changes, or infections that need medical attention. When you suffer in silence, you're not just missing out on solutions, you're potentially allowing serious health issues to progress untreated. I see this pattern constantly. Women who would never hesitate to discuss heart problems or joint pain become completely silent about equally important intimate health concerns. Betty's case required simple hormone therapy and minor lifestyle adjustments. Problems that had plagued her for years were resolved in less than 2 months. She told me, "Dr. Wang, I wasted 2 years of my life suffering needlessly because I was too embarrassed to ask for help." The solution is communication. Your doctor needs to know about pain, changes in sensation, recurring infections, or any concerns in this area. We're medical professionals, nothing you tell us is inappropriate or shocking. These 7 mistakes are quietly robbing millions of women over 60 of comfort, health, and dignity. But now you have the knowledge to protect yourself. Let me recap these critical mistakes: rushing without proper preparation, using harmful pressure points, ignoring hygiene timing, falling into the frequency trap, forcing your body into unsuitable positions, using unsafe tools, and suffering in silence. In my practice, women who avoid these mistakes report 90% fewer complications, infections, and discomfort. More importantly, they report feeling confident, comfortable, and in control of their health. Here's what I want you to remember: your health and comfort matter at every age. The changes in your body after 60 aren't failures, they're evolutions that require updated knowledge and approaches. You deserve to feel comfortable in your own body. You deserve to have honest conversations with healthcare providers who respect your concerns. And you deserve accurate information that protects your health rather than putting it at risk. Your age doesn't disqualify you from comfort, pleasure, or proper medical care. In fact, as you've learned today, it makes proper information and technique more important than ever. If this video helped you understand something new about your health, I want to hear from you. Which of these 7 mistakes surprised you most? Share in the comments below. Your experience could help another woman feel less alone and more informed. For more honest, practical health guidance specifically created for women over 60, subscribe to Elderly Health Central. Next week, I'll be discussing the 5 warning signs that require immediate medical attention, symptoms that too many women ignore because they think they're normal aging. And if this information could help a friend, sister, or anyone in your life, please share this video with them. Sometimes the most important health conversations are the ones we're most reluctant to have. Remember, staying informed is staying healthy. You deserve both.